Methods of use for this motor assessment scale. The description. First, 8 items assess areas of motor function. It takes 15 minutes to complete. Patients perform each task 3 times. Only the best performance is recorded. Okay, next items, with the exception of the general tonus item, are assessed using a 7-point scale, which is 0 to 6.
A score of 6 indicates optimal motor behavior. For the general tonus item, the score is based on continuous observation throughout the assessment. A score of 4 in this item indicates a consistently normal response. A score more than 4 indicates persistent hypotonus, and a score less than 4 indicates various degrees of hypotonus.
Equipment required are stopwatch, 8 jelly bean, polystyrene cup, rubber ball, stool, comb, spoon, pen, tube, tea cup.
Other than that, we also need water, prepared sheet for drawing lines, cylindrical shaped object like a jar, table, cup, bed, pillow, tape, measuring tape, and stick.
So, there are 8 items that can be accessed in motor assessment scale. First, supine to side lying, supine to sitting over the edge of the bed, balance in sitting, sitting to standing, walking, upper arm function, hand movement, and advanced hand activities.
Item scores, with the exception of the general tonus item, are summed to provide an overall score of 48 points. Completing a higher level item suggests successful performance on lower level items, and thus lower items can be skipped.
Assalamualaikum and hi, my name is Anissa. Today we perform motor assessment scale. Okay, this I will teach you how to assess from supine to side lying. Okay, side lying to the intact side. Okay, first the patient will use intact arm to pull body towards intact side, and the leg, the intact leg will hook the impaired leg to pull it over. Okay, the leg. Okay, the starting position is supine lying and knee straight at 10. Okay, the leg, the intact leg is left side. So, and the intact arm will pull the body to the intact side. The intact side is the left side. Okay, next for the second, the patient actively move impaired leg across the body to roll, and but the impaired arm leave behind. Like this, the impaired arm leave behind. Okay, third, the patient give the impaired arm across the body with the other arm, and the impaired leg move actively, and body follows as a block. Okay, the patient will the impaired arm will leave the impaired arm across the body, and the body and the leg will move as a block. Okay, fourth, actively move impaired arm across the body, and the rest of the body move as a block. Okay, the patient impaired arm will actively move, and the rest of the body will move as a block. Okay, for fifth, patient will actively move impaired arm and leg, rolling to intact side, but overbalance. Okay, for the last one, which is the better, the patient will roll to intact side in 3 seconds, but without using hands. Okay. Next, you call side lying to sitting position. It's not the way patients are unable to side lying to sitting position, but patient can do a head sideways. For example, patient is side lying, right? And kita angkat kepala. Okay, patient can do this position only. Okay, next for the grade 2, patient can sit but with assisted by physiotherapy and have a good head control. Okay, so I will help patient to move their leg and body. Okay, this is for the third steps, where the patient may be assisted to side lying and assisted with lowering the legs off back to assume sitting. Okay, so I will assist the patient to side lying, and the patient will assist him leg and to sitting. Okay, side lying. I will assist at the waist, and the patient will assist their leg. Okay, next the fourth step, which is the patient may be assisted to side lying but able to sit without help. Okay, I will assist the patient at the waist. Okay, side lying 1, 2, 3.
For number 5, patient is able to move from supine to sitting without help. For number 6, the patient is able to move by herself in 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, this means that the patient is able to move by herself from supine to sitting within 10 seconds.
Okay, balance sitting. There are 6 grades in balance sitting. First, patient can sit but need support to remain sit. This will support patient at the back and at the side. For example, like this. Okay. Second, for the grade 2, patient can sit but folded at the hands, feet on the floor, and then remain in this position for at least 10 seconds. Wait for 10 seconds. Alright. Okay, for grade 3, patient can sit but throw forward. Okay, leg on the floor. Weight distributed on the both leg equally. Throw forward. The head and thoracic spine is extended. Okay. For grade 3, patient can this is for grade 3. For grade 4, patient can sit hands on the both side. Weight distributed on the both leg equally. Posture back is straight, and then turn to see right shoulder and the left shoulder. Head and trunk should turn. Okay. Then grade 5, patient can sit unsupported. Then do arm reach forward for at least 10 cm in front of the patient. During do this, patient cannot move their leg, and for example, affected side is at the left, and we need support at the affected side. Okay. Then lastly, grade C. For grade C, patient can sit unsupportedly, and then do side away at the right and at the left. Support the affected side if needed. Make sure leg does not move. Okay.
Assalamualaikum warahmatullahi wabarakatuh. My name is Azahra. Today I will demonstrate how to make the patient from sitting to standing according to motor assessment scale. Okay, the first one, patient is assisted to standing by using any method. Means that I can help her by holding her one side and then or give her a walking aid. Okay, for today I will show you helping the person by holding in one side. Okay, the patient need to standing. Okay. I will help her from her one side. That is the first one. The second one, the patient is assisted to standing, but her weight is unevenly distributed and may use her hand for support. Okay. You need to use your hand for support. Okay. She might use her hand for support. Okay, I will assist her. She use her hand for support, which is to press and then she stand up. 1, 2, 3. This is the second one. For the third one, the patient is stand up. The weight is evenly distributed and the hip and knee is flat. Okay, the patient no need to use her hand support and then just stand up. Okay, just sit down. The fourth one, patient stand up. Patient stand up. Patient stand up by her hips and knee in the extent. She need to stand up within 5 seconds. Okay, stand up. 1, 2, 3, 4, 5. Okay, the fifth is the patient may stand up and sit down again. She needs when standing, she needs to extend her hips and knee, and the weight is evenly distributed. Okay, the patient is stand up and then sit down again. Okay, the last one, which is number 6, the patient needs to standing and sitting in 3 times for within 10 seconds, which is her weight is evenly distributed, and when standing, her legs, which is hip and knee, is extended. Okay, you need to standing and sitting 3 times in 10 seconds. Okay, start. 1, 2, 3. Means she can do 3 times sitting to standing in 10 seconds.
I will do the motor assessment skill for walking as point. So the equipment needed is a measurement tape, the tape, and assistive device. For grade 1, which assistant patient stand on the affected leg with the affected weight bearing, it extends and step forward with intact leg. With assistance, like that. Okay, for grade 2, patient will walk with assistance of one person. Okay, for grade 3, patient will walk independently without assistance but with assistive device about 3 meters or 10 feet. Okay. Okay, done. Okay, for grade 4, patient will walk 5 meters of 16 feet without assistance or without device in 15 seconds. Okay, ready? 1, 2, 3. Okay. Okay. For grade 5, patient will walk 10 meters or 33 feet without assistance or without device. Then at the end of 5 meters, patient able to pick up a small object from the floor with either hand, right or left, and walk back in 25 seconds. Okay. Get ready? 1, 2, 3. Okay, for grade 6, patient will walk up and down of the stairs 4 steps without or with device assistance but without touching or holding the tray. Okay. Please, I ask you to glide up and down 4 times, 4 steps, 3 times repetition and in 35 seconds. Okay, ready? 1, 2, 3.
Alright, the next section is called upper arm function. The assist step. Okay, the first step, patient is umpan lain. Okay, and then assist the patient shoulder at 90 degree and ask the patient to towards the ceiling and do the protract of the shoulder. Second one is patient still in the supine position and then do the shoulder flexion in 90 degree with slightly external rotation and elbow 20 degrees of full extension and ask the patient to hold for 2 seconds. 1, 2. Alright, next patient in supine position. Okay, patient leave the hand in 90 degrees of shoulder flexion and then put the hand on the forehead in flexion and then extend. Okay, alright. Alright, the next one is patient in the sitting position. The flattened arm have to lift in 90 degree and then slightly external rotation and supination. No pronation elevation is required. So ask the patient to hold 1 to 2 seconds. Okay, 1, 2. Okay. Alright, next patient in the sitting position. Okay. Okay, patient have to do the shoulder flexions in 90 degree and hold it until 10 seconds. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then slowly down it with slightly external rotation and forearms finish. Okay. Alright, the last one is patient in the standing position. Ask the patient to abduct the hand on the wall, leg on the wall 90 degree, and then while maintain the body, ask the patient to turn toward the wall.
I will do motor assessment scale for hand movement. The equipment needed is cylindrical object, polystyrene cup but I change with plastic cup, ball but I change with a small container, and stopwatch. So number 1, patient in sitting position at table, affected arm resting on table in pronation and elbow supported, wrist slightly extend, place cylindrical object at patient's arm and ask patient to lift object from the table, no elbow flexion allowed. Number 2, patient sitting at table, affected forearm resting on table in neutral position and elbow supported, place cylindrical object at patient's arm, ask patient to lift the object from the table in radial deviation without any wrist flexion or extension allowed. Okay, number 3, patient in sitting position, ask patient to put the affected arm on the table in supination without elbow supported, ask patient to do pronation, and from pronation, ask patient to do supination. Number 4, patient in sitting position at table, put a small container away from the patient, ask patient to protract the shoulder, extend the elbow and extend the wrist, pick up the small container and put it back. Okay. Number 5, patient sitting at table, using affected forearm, ask patient to pick up the polystyrene cup and put on the other side of body without any alteration of the cup. Number 6, ask patient to do continuous opposition of thumb started with index finger 14 times in 10 seconds. Step for 5, 6, 7, 8, 9, 10, 11, 12, 14. Alright. That's all.
Alright, the next section is called advanced hand activities. Okay, ask the patient to reach out the top of the pen and then bring the top of the pen in front of their body and put it down with the affected arm. Okay. Alright, the next one is there are 2 cups here. We will put the 8 jelly beans on the cup that have in the affected arm, and then ask the patient to pick the jelly beans and put the beans on the cup which is on the intact side. Okay, so repeat it until 8.
For grade 3, I will draw a vertical line on a piece of paper. Then I will have my patient to draw a horizontal line to touch the vertical line. The goal is 10 lines in 30 seconds with at least 5 lines stopping at the vertical. Okay, one vertical line, another one vertical line. Then I will ask my patient to sambungkan line yang biru ni. Okay, 1, 2, 3. Buat lagi. Buat 10. Okay, for grade 4, have the patient pick up the pen and pencil. Pick up the pen. Okay, then hold the pen as for writing and position it without assistance and make rapid consecutive dot, not stroke, on the sheet of paper. At least 2 dots a second for 5 seconds. 1, 2, 3. Okay.
Number 5, patient sitting at table. Use the affected arm. Take a spoon of liquid to the mouth without head turn toward the spoon or spitting it. Number 6, use the comb at the back of the head with shoulder abduction and external rotation. Okay.